Hi, now we go to musculoskeletal system anomalies. So our first anomaly is cleft palate or cleft lip. It is an opening or split in the roof of the mouth that occurs when the tissue doesn't fuse together during development in the womb. Common abnormality that affects 1 in 700 babies and may appear separately or together. Causes are, normally, the tissues that make up the lip and palate fuse together in the second and third month of pregnancy. But in babies with cleft palate and cleft lip, the fusion never takes place or occurs only partway, leaving an opening or a cleft. Some researchers believe that it is caused by an interaction of genetic and environmental factors. In many babies, a definite cause isn't discovered. Now the appearance would be, it can be a split in the lip and roof of the mouth that affects one or both sides of the face, or a split in the lip that appears as only a small notch in the lip or extends from the lip through the upper gum and palate into the bottom of the nose. It can also be a split in the roof of the mouth that doesn't affect the appearance of the face. So when these children grow, or these babies grow, they tend to have speech problems or difficulties, and they tend to sound nasal. Second anomaly is arthrogryposis. It is also called arthrogryposis multiplex congenita, or AMC. Arthrogryposis means that the joints are curved or crooked. Multiplex, meaning it affects more than one joint. Congenita, meaning the condition is present at birth. Now, this condition in which a child is born with contractures of the joints. Oftentimes, both the arms and legs are affected. Most common type of arthrogryposis is called a myoplasia, in which the hands, wrists, elbows, shoulders, hips, feet, and knees are affected. Now this is a rare disorder occurring in 1 out of every 3,000 live births. The causes of arthrogryposis, while there is no single cause for arthrogryposis, one known factor is fetal akinesia, which is a decreased fetal movement in utero. During early growth phase, joint development is almost always normal. Motion or movement is essential for joint development and tissue structures. When there is a lack of fetal movement, this can cause extra connective tissue to develop, causing stiff or mobile joints. Now, the longer the immobility, the worse the contracture. Other factors such as extrinsic factors are maternal infection, drugs, trauma. Intrinsic factors such as neurological conditions, there is a malformation of spinal cord or brain during development, or connective tissue disorders such as affecting the tendons, ligaments, bones, or joint linings. Now, fetal akinesia usually has nothing to do with what the mother did or did not do while she was pregnant. Okay? Now, the symptoms of arthrogryposis in babies are thin, weak or atrophied, stiff or missing muscles, stiff joints due to extra tissue, fibrosis or fibrous ankylosis, differences in the skin around their joints, such as webbing. Now, the main point to remember is that AMC is not a progressive disorder. Typically, these children have normal speech and learning capabilities, and with proper care, vigorous therapy, and in some cases, surgical interventions with potential for them to lead a productive, rewarding, independent lives is excellent. Next is developmental dysplasia of the hip. Now, this is a condition where the ball and socket joint of the hip does not form properly. It is sometimes called congenital hip dislocation or hip dysplasia. About 1 or 2 in every 1,000 babies have DDH. Now, the causes can be children with a positive family history of DDH, females occurs more than males, firstborn babies whose fit in the uterus is tighter than in later babies, breech babies whose constrained position tends to strain the joint's ligaments. Now, the symptoms would be the leg on the affected side or the dislocated hip may appear shorter and abducted or turns outward. The folds in the skin of the thigh or buttocks may appear uneven. The space between the legs may look wider than normal. In hip dysplasia, the socket or acetabulum is too shallow and the ligaments too loose, allowing the ball of the thigh bone, femoral head, to slip partially or completely in and out of the hip socket. The baby's womb position can increase pressure on the hips, so the positioning of the baby in the womb can cause more pressure on the hips, joint, stretching the ligaments. It's thought that the babies in a normal position in the womb have more stress on the left hip than on the right hip. This may be why the left hip tends to be more affected. Signs that parents might notice include asymmetry. There is asymmetrical buttock creases, hip click. Hip clicks or pops can sometimes suggest hip dysplasia. Limited range of motion. Parents may have difficulty changing their diapers. Pain. While pain is not normally present in infants, but it is more present in adolescents or young adult. Sway back. A painless but exaggerated waddling limp or leg length discrepancy are the most common findings after learning to walk. Pollen syndrome. This is a disorder in which affected individuals are born with missing or underdeveloped muscles. 1 in 10,000 to 100,000 people have Pollen syndrome, so this means that it is rare. People with Pollen syndrome are typically missing part of one of the major chest muscle, named the pectoralis major. Now, the causes of Pollen syndrome would be idiopathic. It is still unknown, and some researchers have suggested that it may result from disruption of blood flow during development before birth. It is also thought to be caused by a genetic change. The symptoms of Pollen syndrome would be a visible lack of chest muscle in the pectoral area, a chest that appears concave, an underdeveloped or missing nipple on the affected side, missing armpit hair, a seemingly missing shoulder, an elevated shoulder blade, an underdeveloped rib cage, shorter fingers on one hand always on the same side as affected part of the chest muscle, fingers that are webbed or stuck together, a shorter forearm on one side, and underdeveloped breasts in women. Amelia. Amelia defined as the complete absence of the skeletal part of a limb is generally thought to be a sporadic anomaly. It can present as an isolated defect or an associated malformation, particularly abdominal, wall, and renal anomalies. Teratogens such as thalidomide, alcohol, vascular compromise by amniotic bands or other causes, and maternal diabetes have been reported to cause this severe limb deficiency. Syndactyly. This is a condition wherein 2 or more digits are fused together by skin or soft tissues. Now, this is the most common malformation of the limbs, affecting about 1 in every 2,000 to 3,000 children born each year. Now, the main symptom of syndactyly is webbed fingers or toes. The condition can range from minor webbing at the base of the digits to being joined by underlying bones. Patients may also notice that affected fingers or toes do not move well. Now, we have 2 types of syndactyly. We have 1, complete syndactyly, meaning fingers or digits completely extends all the way to the fingertips. They are joined together. Incomplete syndactyly means that the fingers or digits fused does not extend all the way to the fingertips. These are the causes of syndactyly. An irregularity when gestation splits into separate fingers while the baby is still in the womb. Some may occur due to a genetic or inherited defect, environmental exposure during pregnancy, or a combination between genetic and environmental exposure. It may also occur as part of underlying genetic syndrome and can be found in over 300 different genetic syndromes. Polydactyly. Now, the term comes from the Greek words poly means many, dactyly or dactylos means digits. Now, this condition in which a person is born with extra fingers or toes. This tends to run in families, may also result from genetic mutations or environmental causes. Now, the usual treatment here is surgery to remove the extra digit. The symptoms of polydactyly is an extra finger or toe. The condition can range from a small extra bump on the side of the hand to a finger that widens to end in two fingertips, an extra finger that dangles by a thin cord from the hand, or a hand that has a thumb and 5 fingers. There are 3 types of polydactylies. First, post-axial polydactyly refers to the polydactyly where the additional digit grows particularly in the ulnar side of the hand or the fibula side of the foot. Here is the ulnar side of the hand. Preaxial polydactyly refers to the polydactyly where the additional digit grows particularly in the radial side of the thumb or in the tibial side of the foot. Thumb, radial side. The third type would be central polydactyly, occurs in the middle digits of the hand or foot. Now, the causes of polydactyly, it can be hereditary or genetic. Now, polydactyly happens before a baby is born. When a baby's hands and feet are first forming, they're shaped like mittens. Then the fingers or toes form. If an extra finger or toes form, this causes polydactyly. Triphalangeal thumb. It is a congenital malformation of the hands where the thumb has 3 phalanges instead of 2. The extraphalangeal bone can vary in size from that of a small pebble to a size comparable to the phalanges in the non-thumb digits. Now, the true incidence of the condition is unknown, but is estimated at 1:25,000 live births. In about 2/3 of the patients with triphalangeal thumbs, there is a hereditary component. The cause of malformation of the upper extremities can occur in the 3rd to 7th embryonic week. In some cases, TPT is hereditary. Now, in these cases, there is a mutation on chromosome 7q36. The most common symptom for this malformation is basically the presence of 3 phalanges in the thumb of the hands. Now, this can be diagnosed by the use of X-ray.
Good afternoon, everyone. I am going to continue the discussion on the anomalies of the musculoskeletal system. So first up, we have the Holt-Oram syndrome. So the Holt-Oram syndrome is also known as the heart-hand syndrome. It is an autosomal dominant disorder associated with chromosome 12, and it causes anomalies of the heart and the upper limb, which means to say it can affect the hands, arms, or shoulder. So as you can see in figures A and C on the slide, people with Holt-Oram syndrome have at least one of the bones in the wrist, the carpal bones, that is abnormally formed. Other bones of the upper limb may also have formed abnormally. These may include a missing thumb, a long thumb that looks like a finger, bones in the forearm or upper arm, partially or completely missing, and problems with the shape of the collarbone or the shoulder blade. These developmental changes can only be seen on an X-ray, as you can see on figures B and D. Likewise, it is important to note that most people with Holt-Oram syndrome have also heart problems, including the way the heart was formed or the way the heart beats. Next anomaly on my list is scoliosis. So scoliosis is an abnormal curvature of the spine or a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. So the normal shape of a person's spine includes a curve at the top of the shoulder and a curve at the lower back. So if your spine is curved from side to side or is in an S or C shape, you might have scoliosis. Moving on to the causes of scoliosis. So while scoliosis can be caused by conditions such as cerebral palsy and dystrophy, the cause of most scoliosis is still unknown. In fact, about 3% of adolescents have scoliosis. So most scoliosis are mild. However, some spine deformities continue to get more severe as children grow. For instance, an especially severe spinal curve can reduce the amount of space in the chest or within the chest, making it difficult for the lungs to function properly. Common causes in children when pinpointed are birth defects, which includes neurological abnormalities, and genetic conditions. People with scoliosis show the following signs and symptoms. First, uneven shoulders. Second, one shoulder blade appears prominent than the other. Third, uneven waist. And last but not the least, one hip appears higher than the other. Now we have muscular dystrophy. It's a group of inherited diseases that damage and weaken the muscles over time. This damage and weakness are due to the lack of the protein dystrophin, which is necessary for normal muscle function. Basically, the absence of this protein can cause problems with walking, swallowing, and muscle coordination. Muscular dystrophy can occur at any age, but most diagnoses occur in childhood. There's no known cure for muscular dystrophy, but certain treatments may help. So now we are going to tackle 5 types of muscular dystrophy, and these are the following: Duchenne muscular dystrophy, Becker muscular dystrophy, limb-girdle muscular dystrophy, facio-scapulo-humeral dystrophy, and congenital muscular dystrophy. Okay, let's start with Duchenne muscular dystrophy or DMD. So DMD is an inherited muscular disease that involves muscle weakness, which quickly gets worse. Specifically, children with Duchenne will develop problems with walking and breathing, and eventually the muscles that help them breathe and the heart will stop working. So this type of muscular dystrophy is the most common among children, especially the boys. Just like all types of muscular dystrophy, Duchenne is caused by a genetic mutation that prevents the body from producing dystrophin. And as you can remember from the previous slide, dystrophin is a protein necessary for normal muscle function. Duchenne is considered to be an irreversible progressive disease and has currently no cure. People or children with DMD show the following symptoms: not being able to walk until approximately 18 months of age, walking on toes with the legs apart and or with the belly pointed out, falling down often, needing help getting up from the floor or using arms to walk the body to a standing position, also called Gower's maneuver, larger calves than other children of the same age or size, experiences fatigue, behavior and learning problems, as well as delayed speech. Next type of muscular dystrophy is Becker muscular dystrophy. This is similar to Duchenne muscular dystrophy but is less severe. This type of muscular dystrophy also more commonly affects boys, with muscle weakness occurring mostly in the arms and legs and with the symptoms appearing between age 11 and 25. Becker muscular dystrophy is caused by a mutation in the DMD gene that is responsible for the production of dystrophin. A person with Becker muscular dystrophy experiences one or all of the following symptoms: walking on their toes, frequent falls, muscle cramps, and or trouble getting up from the floor. So since Becker muscular dystrophy is less severe compared to Duchenne muscular dystrophy, many people with this disease don't require a wheelchair until they're in their mid 30s or older. And a small percentage of people with this disease don't even require one. Most people with Becker muscular dystrophy live until their middle age or later. The third type of muscular dystrophy that we are going to discuss today is called the limb-girdle muscular dystrophy. So in this disease, hip and shoulder muscles are usually affected first. People with this type of muscular dystrophy might have difficulty lifting the front part of their foot and so might trip frequently. Onset usually begins in childhood or the teenage years. Limb-girdle muscular dystrophy is caused by mutations of genes that result in the abnormal function of proteins in muscles. thereby causing progressive muscle weakness. People with limb girdle muscular dystrophy show either one or all of the following signs and symptoms. Progressive weakness, muscle atrophy, mainly involving the shoulder and or pelvic girdle. Pelvi-femoral distribution of weakness in most childhood onset cases. Adult onset disease usually involves both shoulder and pelvic girdles with gradually increasing proximal limb weakness. And lastly, facial weakness is usually mild or totally absent. We are already on the second to the last type of muscular dystrophy, which is called Scapulo-Humeral dystrophy, which is also known as Landauzi-Dejerin disease. This type of muscular dystrophy affects the muscles in your face, shoulders, and upper arms. It can also cause loss of hearing. Facioscapulohumeral dystrophy, or FSHD, is caused by genetic changes involving the long arm of chromosome 4, which results in the lack of proteins necessary for the normal functioning of muscles. Symptoms of FSHD includes difficulty in chewing or swallowing, slanted shoulders, a crooked appearance of the mouth, a wing-like appearance of the shoulder blades, and some may develop hearing and respiratory problems. We are on our last type of muscular dystrophy, which is congenital muscular dystrophy. So this is a genetic disorder which is often apparent between birth and age 2. This is the time when parents begin to notice that their child's motor functions and muscle control aren't developing as they should be. Just like all the types of muscular dystrophy that I have discussed, CMD or congenital muscular dystrophy is also caused by genetic mutations affecting some of the proteins necessary for muscles and sometimes for the eyes and brain. Symptoms of CMD vary and may include muscle weakness, poor motor control, inability to sit or stand without support, scoliosis, foot deformities, trouble swallowing, respiratory problems, vision problems, speech problems, and intellectual impairment. And that ends our discussion for today. Now it's time for comprehension check, and we will do that by playing a game online. Earlier, before the class started, we have already given you the game code. Now all you have to do is to open a new tab in any browser and type in joinmyquiz.com. After that, you can log in using the game code. And you're ready to go. Let's get this started.